Hello doctors, welcome back to the series of NEET MDS 2021 Recall. In this video, we are going to see about an interesting topic, that is Graves' disease, from the subject General Medicine. So Graves' disease. So this is the question they have given. So they have given an image of the thyroid scan of the patient. So the patient complains of anxiety, irritability, fine tremor of hands and fingers, heat sensitivity, and increase in perspiration along with warm moist skin and weight loss. So the thyroid scan reveals the following. Okay, so actually we don't insist much on thyroid scans and all while we are preparing for the exam, but such questions may also be asked. So sometimes like image based and clinical based questions, so please keep in mind like to revise all the things, all the possible things. Okay, so the probable diagnosis is the options given were thyroid carcinoma, hypothyroidism, Graves' disease, and toxic multinodular goiter. So to arrive for an answer to this question, you need to know how the thyroid scan looks in all these conditions. Okay, so then only you will be able to arrive to a question, to an answer. Okay, so coming to Graves' disease. So the Graves' disease is also known as toxic diffuse goiter. It is an autoimmune disease that affects the thyroid. So it also often results in an enlarged thyroid. So the thyroid gland is enlarged in Graves' disease. So it is 5 to 10 times more common in women than in men. So it almost affects 2% of adult female population. And coming to the signs and symptoms, so signs and symptoms of Graves' disease are very much similar to hypothyroidism and all. So here you can see in this image muscle wasting, fine hair, exophthalmos, goiter, sweating, tachycardia, weight loss, oligomenorrhea, tremor. So these are all some signs. So Graves' ophthalmology, this is an important sign. Goiter is also an important sign. Pretibial myxedema is also an important sign. Insomnia, hand tremor, hyperactivity, hair loss, excessive sweating, oligomenorrhea. So these are some common symptoms which we see in thyroid gland diseases, right? Itching, heat intolerance, weight loss despite increased appetite, diarrhea, frequent defecation, palpitations, periodic partial muscle weakness or paralysis. So these are some signs and symptoms which we see commonly. But Graves' ophthalmology, goiter, and pretibial myxedema are some which are peculiar to Graves' disease. Then on physical examination, what we see? We commonly see an enlarged non-tender thyroid. Okay, lid lag is seen. Okay, eyelid lag. Then excessive lacrimation due to Graves' ophthalmology. So excessive lacrimation due to Graves' ophthalmology. Along with that, arrhythmias of heart such as sinus tachycardia, atrial fibrillation, and premature ventricular contractions and hypertension is seen. Okay. And coming to the diagnosis, so how we diagnose it? So here you can see in this image the thyroid scans of normal thyroid gland. Okay, this is a thyroid scan of normal thyroid gland. This is of Graves' disease. So you can see the uh, picture, like you can see the intensity with which the darkness is there in Graves' disease, and here it is an autonomous nodule. So here a nodule kind is seen. So we'll see what all these is. So two signs are truly diagnosis of Graves' disease. So one is what is it? It is not seen in other hypothyroid conditions. So that is exophthalmos. So I told you ocular signs, and non-pitting edema, that is pretibial myxedema. Okay, thyroid gland enlargement is also seen in some other conditions also, but these exophthalmos and non-pitting edema are truly diagnostic signs of Graves' disease. So keep in mind. Another signs of Graves' disease is hypothyroidism. So since it is also a sign of Graves' disease, we find so many symptoms similar to hypothyroidism. So to differentiate hypothyroidism and Graves' disease, we take these two signs as diagnostic signs. So that is overproduction of thyroid hormones of T3 and T4. Of course, the goiter in Graves' disease is often not nodular. Okay, nodular goiters are present, but Graves' disease, the goiter is not nodular, but thyroid nodules are also common. Differentiating common forms of hypothyroidism such as Graves' disease, single thyroid adenoma, and toxic multinodular goiter is important to determine the proper treatment. So, to determine the difference between all these diseases which are affecting thyroid gland, we take up a scan. What is that scan? Uptake and pattern of diagnostic radioactive iodine by thyroid gland. So it is that the uptake is how it is. It is diffuse in Graves' disease, patchy in autonomous nodule, and little or none in gland destruction. Okay. So this is we give radioactive iodine to the thyroid gland. So when it uptakes, we observe how the thyroid gland is being represented in by taking a thyroid scan. Okay, so the thyroid scan, when it is taken, normally it shows like this. In Graves' disease it is diffuse pattern, and patchy in autonomous nodule. So you can see this nodule like things, little or none in gland destruction. Okay. Then management of Graves' disease. So treatment includes antithyroid drugs and radioactive iodine and thyroidectomy. So thyroid scan here, we have attached pictures of other thyroid scans also. So this is how thyroid carcinoma looks like on in a thyroid scan. Okay. So autonomous nodule is a single nodule like thing. We do not see much of thyroid gland there, but in thyroid carcinoma we can see the thyroid gland, but along with that we can appreciate some nodules like this. Okay. So this is this. And toxic multinodular goiter, you can see the thyroid gland is filled with multiple nodules which are diffusely arranged. So this is the difference in the thyroid scans which we observe. Okay. So coming back to the image, so this is the image of a Graves' disease thyroid scan. Okay, so this is the main thing which we need to remember. And in the question, let's see if we have any like diagnostic features. So we don't have much diagnostic features specific to Graves' disease here, because anxiety, irritability, fine tremors, heat sensitivity, these are also seen in thyroid disease also. Weight loss, they are also seen in thyroidism. So they are not of much value to answer this question, but this image alone will help in arriving for the correct answer for this question. So the correct answer will be Graves' disease. Okay. If you like our video, do subscribe to our YouTube channel. You can also follow us on our Instagram handles at Dogshala for dental content and at Dogshala Medical for medical content. You can also find us on Telegram. Thank you.